Thank you very much for inviting. Actually, today our topic is speaking about how long could we save the patient without perfusion, I mean the vital organs. So, mainly the vital organs are already protected by the oxygenated blood flow from the heart. If there will be any problem in the heart, need to be fixed or need to stop the heart, simply will place a clamp in the ascending aorta and place arterial cannula using the artificial heart, which is a heart-lung machine, and protect the vital organs again. All those things are very simple, but the problem, when there will be a problem in the great vessels, mainly aorta, when there will be damage and need to be fixed, we need to stop whole circulation in the body. That time we need to use a procedure, what we are going to speak inshallah about today. Our procedure, which is deep hypothermic circulatory arrest, means the full cessation of the blood in the body and take the blood outside of the body. From that, we will make a very good environment to the surgeon to work in the great vessels and fix it until he finished. That time we return the blood back. So hypothermia and metabolic rate. This is the physiological principles of deep hypothermic circulatory arrest. Each 10 centigrades drop in temperature reduces oxygen consumption by 50%. At 18 centigrades, which is profound hypothermia, the brain metabolic demand is 10% almost. Cerebral protection. Hypothermia delays ischemic injury by reducing ATP consumption and free radicals production. Electroencephalography will be silenced almost around 22 to 25 centigrades, ensuring reducing neurological activity. Circulatory standstill, as I said before, blood flow intentionally will be stopped, allowing complex procedure to be completed. And to avoid ischemic injury, the safe limit to deep hypothermic circulatory arrest is typically from 30 to 45 minutes. What are the indications? As I said before, if any problem or like aneurysm or dissection or any problem in the great vessels needs to be fixed, that time we need to use this procedure. Like also tumor resection involving the great vessels. What is the procedure, or how could we perform our procedure? Starting with cooling phase, the patient is placed in cardiopulmonary bypass, which is the artificial heart-lung machine. The core temperature is gradually reduced to 18 to 20 degrees centigrade over 30 to 40 minutes. Then the circulatory arrest phase will be started. So once hypothermia is achieved, blood flow is stopped, the procedure is performed, aiming to complete the critical steps within 30 to 40 minutes. Antegrade cerebral perfusion actually can be used to extend the safe duration to the cerebral mainly. Rewarming and recovery, when the procedure is finished and done already, gradual rewarming is critical to avoid ischemia, reperfusion injury and cerebral edema. Core temperature is rise slowly, like 0.5 centigrades per minute, or we can say 2 to 3 degrees. We can say 2 degrees every 5 minutes to prevent complications. Once stable circulation is resumed and the patient is weaned from cardiopulmonary bypass. What are the complications and strategies could mitigate the risks? Actually, the neurological injury, stroke, cognitive dysfunction related also to the ischemia, what was happening, use cerebral perfusion technique and like antegrade cerebral perfusion, minimize arrest time less than 40 minutes. Coagulopathy and bleeding could be happen also. Hypothermia affects platelet function and coagulation factors. Careful rewarming and targeted transfusion reduce risks also. Cardiac dysfunction and arrhythmias, controlled rewarming prevents hyperkalemia, and myocardial stunning. What's our conclusion? Deep hypothermic circulatory arrest is a life-saving technique in complex cardiac and aortic surgeries. Advance in cerebral perfusion strategies has improved outcomes, and proper temperature management, perfusion techniques, and monitoring are essential for reducing complications. These are references and sources. Thank you very much.